have a few little steps that I do myself. So one
Mhm,
is if I'm trying to be informed, like watching the news or reading a post, I
mhm,
will take a moment to just literally take a breath, nothing fancy, and check in and say, am I learning anything new here? Or why am I looking at this or reading this right now? And if I don't have a very clear answer, then I will stop what I'm doing.
and that leads me into it's hard to avoid consuming distressing content, right? I try to avoid it like the plague, but I can't. So how can you still be consuming it or be exposed to it even if you're trying to avoid it and still regulate to where you're using whatever you're consuming into sustainable action, I guess?
Um, so this is where I try to get myself and other people to say, okay, well, what would you do if it was your child for people who are parents, right? Or what would you do if it's your best friend or your partner or your loved one? Because that can sometimes get people out of their own stress responses enough to do something compassionate that's straightforward. So there are apps or ways to brick our phones. I think both of us probably do, but I have to keep my phone on all the time
Mhm.
in case someone calls me and it's urgent. It's usually not. And I would say I put some boundaries and limits in place so that people know if it's urgent, they need to actually say it's urgent because it's easy to miss calls or emails or that kind of thing. But I can't fully disconnect, right? But I don't check routine emails after 8 p.m. That's my limit. I also stop reading the news after 9 p.m. That's just a limit I set for myself. I think I might need to actually maybe make that one 8 p.m. I unsubscribed from a bunch of newsletters and magazines and newspapers and just have one relatively neutral news source. I looked online, it's what counts as sort of an in the middle news source, and I get a digest once a week. So there are ways where we can take direct action. So again, it's more
Mhm.
behavioral, but set some limits up and actually take care of ourselves the way we would with anyone else.
Yeah, yeah, absolutely. Mhm. Yeah. So if we're repeatedly exposed to distressing information and don't give ourselves like recovery time, what happens with our nervous system?
It's right, it's overwhelmed. We're both trying to be truly trauma informed, but it gets overwhelmed to the point where, we have to escape in some way. So people can either shut down, will it really withdrawn or dissociated or numb. That happens. Or we can get more agitated, irritable, lashing out, getting in trouble with family or at work, needing to run away. So sort of those ongoing fight or flight kind of responses that let us know that our nervous systems aren't great at regulating and letting us tolerate the world. So we'll see prolonged stress responses. Cortisol, like we think of it as the stress hormone, but that's a little
Mhm,
simple. But cortisol will spike initially, right? So our body is responding in this stressful way because you mentioned,
mhm,
adrenaline and that will rush through our body immediately. And then we'll have the physical, emotional, and mental effects. So I could be more anxious. My mind could be racing at night, worrying about every terrible thing that could happen in the world, and I might not fall asleep for hours, right? So we can be anxious, more irritable, more dissociated. We could have a real depressive episode, checks all the boxes for major depression. We have the physical effects. Our whole vasculature, so our heart and our blood pressure and our body's ability to respond to stress can actually be affected in a negative way. We can have more acid reflux or, trouble with our GI system. So all
mhm,
these things can happen. And that's why it helps to try to notice as soon as we can, as early in the cycle. And then
mhm,
to get out of it, like I said, maybe we need to go see a therapist or a psychiatrist or a primary care doctor. Maybe we need to recognize our limits and cut back on work. And I would say cut back in a way that actually takes care of ourselves and isn't just like you mentioned, like a 4 week vacation, a 4 day vacation, or even 4 weeks without changing
mhm,
things. So it's, I'd say recognition, as early as possible, taking our signs and symptoms seriously like we would for anyone else, no matter what you want to label it. And so taking care of our whole body health. And then recognizing we might actually need to make a major change in our lives in order to move past the impact of vicarious trauma and burnout. And that's tough because we are human beings and change can be exciting, but it's very scary and it's hard. And it's so much easier, right, to just ignore it or try to stay the course, but that doesn't usually help.
Yeah. And I think you use the word numb, and I wanted to branch off of that. For instance, I am trying not to consume any news, and I will obviously still will, but how does one avoid consuming or over consuming information um that could possibly cause vicarious trauma without actually becoming numb or losing our compassion?
I would say if we're already over consuming and getting to that point, we might already be feeling numb, but we can work through that numbness. Maybe looking at it like this, if the overconsumption leads to addictive like behaviors, like it becomes compulsive, we're not even paying attention to it. It's just nonstop bombardment with news and we're scrolling and scrolling and clicking and reading through a bunch of troll comments that aren't even people anymore. They're bot accounts from some other country, right? So we can easily get sort of stuck in the repetitive nature of everything and overwhelmed. Where was I going with this? Oh, so we need to just set limits like we would with that. Like I said, I unfollowed a lot of
Hmm.
accounts and try to set limits. And some people might have to take a real break from social media
Hmm.
completely. Because if we're already feeling numb, I would argue it's already too late. Not too late to heal from it, but too late when it comes to effects of trauma and burnout.
Hmm. And I don't feel like I'm like numb or avoidant, even though it sounds like I'm avoiding the news. But it's hard to find that balance, right? That I want to continue to regulate my nervous system at the same time, not overconsume. But maybe it's not so much that I feel numb, but I'm appearing maybe like I don't have, because I'm not expressing, going back to the initial thing that we talked about, I'm not expressing an opinion, or I'm not talking about it constantly,
Mhm.
that maybe I don't have any feelings, opinions, or I'm not being affected by it at all. I think that that is what, I struggle with. Someone will ask me, "Oh, do you know what happened today?" Da da da. And no, I don't. Well, I was seeing patients one back to back all day. So no, I don't know. But also maybe I don't want to know. But now that you've asked me, I'm gonna look it up.
Well, but maybe then you're also speaking to what you mentioned before, which is how others see us and what we're doing and not doing and what standards they hold us to, right? If I appear numb to someone else because I'm not aware of something that happened in the news or not fully educated about it, I need to decide, what's my relationship with this person? Do they need to perceive me in a certain way? Do they need to know that I care or not? Because that's more of the perception of numbness or something rather than the nervous system kind of numbness that we see with the trauma.
Mhm. Yeah. Yeah, and I was thinking about how I've been seeing a lot of therapists, and I'm not sure if some of them were psychiatrists, but just on social media, post about how you can't separate therapy or social work or the work that we do from politics and policy, because you just can't. Like, we're seeing people who are directly being affected by everything, forget the world, going on in our country. And so there's a sense of guilt. I don't believe that my patients in any way, shape, or form feel that way from me, that I don't care, or but I haven't posted anything, and there's a guilt related to that. Like, I have like gone back and forth on, do I want to say something? Do I not want to say something? I even created a carousel and then I haven't posted. Like, it's like a
Mhm.
such a weird place to be as a psychiatrist or therapist, as a mental health provider, let's say.
Oh, yeah. So this is sort of goes back to that perception of others, like in the sense of numbness. And This is probably a bigger topic about what being political even means these days, what's professional or unprofessional, and even self-disclosure. So this sort of opens a bigger topic, but each one of us needs to decide what that limit is. I mean, I like to share, sometimes I'll share statements from our major organizations about, uh, about human abuses or trauma or things that are happening. I don't consider that politics, like right versus left, Republican versus Democrat, or, whatever you want to. I don't think about it as politics. I do think about it as world events and more history. And it is,
Mhm.
I agree with you, it's relevant to our patients, it's relevant to our colleagues, but I'm not necessarily the kind of person who shares all the time about advocacy or I mean, I do advocate. I should say then I don't share so much about activism or how
Mhm.
my own identity fits with activism all the time. A
Mhm.
little bit. People can go to my website and see that I support our local LGBTQ organization, which is
Mhm.
Equality Loud, and it's in my county, right? But I'm not constantly posting about it. I actually saw a little video on Instagram. It was a bunch of therapists. I think they were master's level therapists, so they weren't psychiatrists, I don't think. But it was in response to some of the recent, human abuses and deaths, things that are happening. And
Mhm.
they ended up flipping off the camera at the end of their video, right? Now, if I did that as a psychiatrist, well, one, someone could report me for being unprofessional potentially, because we have very strict guidelines for what we're supposed to do. But two, it's something I'd feel uncomfortable about doing that, even though they were directing it against people who are hurting other people. And I will freely use, whatever words my patients use, however rude they might be. I'm comfortable with language. That I wasn't offended by that, but it was the idea of being so open and human in a way where people know even more about you and your beliefs. And so it's a fine line, I guess, just to circle back to what you're saying. So we all have to decide what it is for ourselves and know that others are going to disagree.
Mhm.
Mhm.
Yeah.
Eh, Yeah. But yes, it's a bigger topic, right? I think
It
just
is. It is. What would you say is the biggest effect on just humans, whether they are in our profession or not, biggest effect of vicarious trauma that you're seeing in people?
the helplessness. So not hopelessness always. Some people can still have hope, but
Yeah.
helplessness be sort of I'm overwhelmed now, psychologically, emotionally, even physically. I'm overwhelmed. What am I supposed to do with this kind of question? Because there is no real answer once we get overwhelmed. So
Yeah.
that's what I see.
Mhm.
So
Yeah.
sometimes, we're both psychiatrists, so I'll see people for psychiatric conditions. Our conditions can worsen. They have because of events that are happening. It might not be direct, but indirectly, they could have more symptoms. They could have more brain fog. All right, that's very vague, but they could just feel worse.
Reframing the idea of being or staying informed that also supports our mental health rather than us leading to burnout. Do
Mm.
you have like any recommendations or any ideas on how we could just reframe that idea?
I have a few little steps that I do myself. So one
Mhm.
is if I'm trying to be informed, like watching the news or reading a post or something like that, I
Mhm.
will take a moment to just literally take a breath, nothing fancy, and check in and say, am I learning anything new here? Or why am I looking at this or reading this right now? And if I don't have a very clear answer, then I will close an app, stop what I'm doing, because then I know that I'm just sort of compulsively or addictively sort of here. I found myself here, on this page reading about the same story or going through a bunch of angry comments that human beings probably aren't even posting. So I check in with myself first. Sometimes that's enough. But if I am maybe learning something or wanting to pay attention, then I think, okay, well, what can I do with this new knowledge? Like, what can I do with the fact that someone, came to harm in a violent way? And if I can't do anything that's healing or process or taking action, however small on my part, then that can also tell me that now's not the time to consume that information and to be more aware of what's going on. But if the answer is I can do something with it. I mean, maybe that's when I am creative or when I reach out to my friends. Like I was able to reach out to some of my colleagues in Minneapolis and just say, "Hey, are you doing okay? What do you think we need to know?" And I was able to connect some people to their own mental health care. That was enough for me.
Yeah.
I didn't jump in a plane, and fly
Yeah.
there and
Nor
help out on
help.
the street, and other people have, and I think that's wonderful. But I was able to do something
Right,
with
right.
that knowledge. So if we're able to do something and have that action, that takes us away from that stress response.
That's very helpful. That is all those steps are so helpful. Thank you for sharing that. What do you think now coming from just general population to people that work in the mental health field, what do you think they can do to stay informed? Because, our patients will probably bring something up and in
Mm,
and be compassionate while not completely burning ourselves out.
maybe to go back to the taking care of ourselves like we would anyone else.
Mhm.
Giving ourselves enough space to be able to think and feel and process that way. And then once we do that, see where we need more and don't blame ourselves for it, right? Like maybe we need more mentorship, supervision, our own therapy. Maybe we need more of a support network in our own lives. I mean, there have been times in my life, even outside of residency, where I realized every day I would go to work, I would be fully invested. I mean, maybe I check out a few times, but I do my job, I take care of people. I come home, I would eat, I would watch TV or scroll online, traumatize myself with news, and then I would go to sleep, and that would literally be my life for weeks or months.
Mhm.
All of us can get stuck in that, and that's not healthy. That's not living. So we need to broaden our own lives if we're allowed to be soothed and creative and connected to other people in the world in a way that decreases suffering overall somewhere, then that's healthy.
Yeah, that is helpful. With everything that is going on, and we had been talking about having you back, and you reached out and you were like, "I wanna talk about this." So, this is weighing very heavily on you. I really wanna know how you're doing.
So I would say it depends on the day, it depends on the hour. Like all of us, I can easily get sucked into the news and angered and heartbroken at what's happening. I know a lot of people, their emotions they connect to, sometimes they're more shocked or surprised about some of the news, and I'm less shocked or surprised because of my own experience, my own life experiences, but it does hurt, and you can feel that hurt, physically sometimes. So I've noticed lately, the past it's over a month now, but my sleep quality doesn't seem to be what it was a few months ago. It's more fragmented, or I'll wake up a little bit more, or I'll startle more easily. So I'm just having to take that into account my day to day and
Mhm.
take care of myself a bit more.
Yeah.
Practice what I preach kind of thing.
Yeah. Yeah.
And I've
Absolutely.
also seen more I think I also brought this up because even amongst other community of psychiatrists, so, mental health physicians,
Mhm.
people like to argue about what counts as trauma all the time.
Mhm.
And so I've had some people who believe that I could be uncaring for not being as informed as they are. And they are very much highly involved activist people. I admire their energy, their ability to tolerate crowds, all these things. And then I've had other people who have told me I shouldn't be sharing about trauma or burnout or my own experience at all because psychiatrists were supposed to be fully neutral in a blank slate, and to be somewhat human in this way means that we're judgmental or we could be unprofessional with our own patients. So I've had these different sort of extremes that have come out
Mhm.
just in trying to have conversations with people, so I wanted to bring it up because uh, I don't think those extremes help anyone,
Mhm. Mhm.
and they say more about the individuals sharing them and less about us, but they're distancing, so they actually allow for less connection and more trauma in this long-term way, and we need to come together as much as we can. Doesn't mean we all have to agree, but we need to
Yeah.
connect and we need to understand trauma better.
Yeah. Absolutely. I think it's like the similar thing to, I guess, complex PTSD, right? That concept where, again, the people that want to stick to the definition of PTSD per the DSM, a lot of people that need trauma informed care or, you know, in my opinion, have PTSD, right? Will not meet that DSM criteria. And so other psychiatrists, even therapists or whomever uses the DSM might disagree with me. And I think the same with vicarious trauma. I think that it's very real. We're carrying it. I don't think there are many professions that hear the stuff that we hear on a daily basis, regardless of world events, right? Just from our patients, the amount of trauma some people have gone through. And we hear this stuff day in, day out in different people all day long, right?
Mhm.
And that alone, and then the rest of what is available to us through the world wide web in the palm of our hands
Mhm.
just adds on top, right? Of that. And, I feel like, anyone working in this field and would hopefully be taking care of themselves a little extra during this time.
And respecting our colleagues and
Mhm.
not
Absolutely.
telling them that their experience of trauma isn't real or burnout isn't real or it's all their fault. And
Hmm.
it's so interesting when people get stuck in those narratives. You want to say, wait, you're supposed to be a therapist or you're supposed to be a doctor. Why are you saying these things? We know why, because we talked about it, right? Sort of what's internalized, what we tell ourselves. Mhm.
Hmm. Yeah, absolutely. And I think even though I'm psycho, uh, contemporary psychoanalytically oriented, and I add the contemporary word for this reason, right? It's not about being the blank slate anymore. You have to be human. I feel like the healing is where when your patient, the other person can actually see that you are a human. And I think all of this is being human, having an opinion or not having an opinion or saying something or not saying something. All of it is human and it's very real. And I think that we need to like get out of that block that we have of, oh, just a blank slate thing. I don't think that that is effective or
Well, and it's not true. I mean, it's not true either. There's no such thing as a blank slate, just like there's no such
absolutely
thing as a perfect doctor, a perfect mother, perfect, perfect husband,
right.
or
Right.
perfect person. But it's just sort of what some of us have been taught. Um,
Absolutely. You are so right. And like if we actually go back, let's just go back to complete psychoanalysis, like basic Freud, his notes were very opinionated. Right? He had a lot of opinions. I don't know if you had the chance to read
and,
that
well,
material.
and a product of his time. There's a lot of what we would consider misogynistic opinions, right? But it didn't match up with the right at the time they were accepted,
Yeah.
celebrated even, right? So but I just like we have trouble taking care of ourselves like we would anyone else and acknowledging that vicarious trauma is real and burnout is real and it's not our fault. And we also sometimes have trouble giving up past ideas of what the world should be and how we should act and all these things.
Yeah. Absolutely.
But I
I
agree with you. I mean, the reason therapy works isn't necessarily because of theory or technique. It's because of that, a real alliance or a real relationship and connection and trust with another person.
Yeah.
Sort of circle back. This is why I think generative AI can't be therapist. Right?
Yeah.
It can't build that. It's not real. Um, and then being able to be different from another person and move through
Yeah.
that,
Yeah.
recognizing your therapist as a person and not perfect and makes mistakes.
Yeah. And interestingly, I don't know if you've noticed or not. I mean, I'll use AI to kind of sort through ideas or just get like an idea to
Mhm.
like work off of or something. And recently I've just noticed a decline in it and like really limitations and decline in what it can make you available to
Mhm.
you. In someone that works in IT and works a lot with this stuff was saying that it's like having an intern. When we have interns in IT, they're messing up all the time. And that's what AI is. And that's how he explained it to me. He was like, just having an incompetent intern is what he said.
Yeah, but an intern who can't necessarily grow, because I don't there
Mhm,
isn't it doesn't I mean, AI is we can sort of go into this, and it does fit back with burnout and trauma,
mhm,
but it's not going to save us from our own circumstances. Um, we can theorize all we want about intelligence, but artificial intelligence isn't quite at a level of sentience, of
mhm,
understanding, and if it is at some point, it's not going to be the way we think. 'Cause
mhm,
we're human beings. So it's an intern that never learns or grows.
mhm.
We were all interns. I was I got to we all had those moments in our own lives, and we got to grow and recognize our own unique traits and capacities and
Mhm.
strengths and weaknesses and all of it. But AI doesn't do that, and AI will always just give us what it thinks we want to hear, what the
Yeah,
majority or the norm is,
yeah,
which doesn't
yeah,
help.
yeah. And that's why I think he added the word incompetent.
Mhm.
An incompetent
But
intern.
it's because it starts with what we think we want to hear or what it thinks, we want to hear is majority, it doesn't always seem incompetent at the beginning. That's the tricky
Absolutely.
part.
Yeah. Well, thank you so much for coming on, talking
Mhm.
about this very heavy topic. And hopefully, we all are able to take away something from this conversation and take care of ourselves and, play our whatever our role is and be okay with playing that role in all of
Mhm.
this.
I guess the one piece I would highlight would be just taking care of yourself like you would anyone else. Vicarious trauma is real trauma, and it's not just what happens, it's the impact it has on us. Um,
Hmm.
and so we need to be able to take care of ourselves. If
Hmm.
that's too hard and too many words, pick one of those old sayings. You can't pour from an empty cup, right? Or
Absolutely. Hmm.
put on your own oxygen mask before your child if you're on an airplane, whatever it is.
Hmm.
Anything that will help us know in the moment that we need to take care of ourselves.
I agree. Yeah, I really like the oxygen one because if you can't breathe, you're not going to be able to help the person next to you. you know, because I think that sits in like you're gonna die. like pouring the laws can wait or whatever, right? But like literally, you're gonna die. But thank you so much, Mariel. It's
Me
always
too.
a pleasure having you.
Good conversation.